The scene is safe, my gloves are on, my rescue mask with a one-way valve is available. The scene is also safe enough to use an automated external defibrillator because I've checked for flammable gases, liquids, or a pool of water that the victim might be lying in, which is not the case. I tap and shout on the baby, "Are you all right? Are you okay?" They don't respond. I activate EMS by calling 911 or calling a code. You in the plaid shirt, go call 911 and come back. If you see an AED, bring it with you. But in this case, I already have one, so that's not needed. Now I'm going to assess for regular breathing, normal breathing, and a brachial pulse. The baby has no pulse and is not breathing normally. But because I have the AED, I'm going to go ahead and start it now. Pushing the power button on.
Remove clothing from person's chest.
I remove the clothing, pat them dry if they're damp.
Attach pads firmly to person's chest as shown.
If there's infant pads for this infant patient, I'm going to use them, and they are here, so I'm going to use infant pads. Stick one to the chest on the front.
Plug-in connector.
I'm going to carefully roll the baby onto their side,
Check connector and pads.
place the second pad on their back, and lay them carefully back on their back.
Check connector and pads.
Plug in the connector.
Analyzing rhythm. Everyone stand clear.
Clear.
Shock advised. Charging. Everyone stand clear. Everyone stand clear. Push the shock button.
Clear.
Shock delivered. Begin 5 cycles of CPR.
3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Two, 3, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14,
1
15,
minute and 30 seconds of CPR remain.
1, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 6 and 7 and 8 and 9 and 10 and 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30.
1 minute of CPR remain.
1, 2, 3, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. 1 and 2 and 3 and 4 and 6 and 7 and 8 and 9, 10, 11, 12, 13, 14, 15, 16, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 24, 25, 26, 27, 28, 29, 30.
Analyzing rhythm. Everyone stand clear.
Clear.
Shock advised. Charging. Everyone stand clear. Everyone stand clear.
Clear.
Push the shock button. Shock delivered. Begin 5 cycles of CPR.
1, 2, 3, 4, 6, 7, 8, 9, 10, 11, 12. Now I'm going to continue to do these 30 compressions and 2 rescue breaths until the baby begins to respond, breathe normally, or more definitive care takes over and the patient is then taken to the next level of care.